So you are planning to visit a mental health practitioner by the end of this week, but you're unsure whether you should visit a counsellor, a clinical psychologist, or even a psychiatrist. Do all these different titles actually mean the same thing? Well, the short answer is no. Watch this video to find out more about it. Counsellor, clinical psychologists, and also psychiatrists are three different professions, and each of them actually focus on different aspects of a patient with mental health issues. Yet it is actually very common for their job scope to be overlapping with one another. For example, clinical psychologists and also psychiatrists can actually provide psychotherapy to their patient. How can we actually differentiate between these three different professions? Well, today in this video, we will be focusing on these three different professions on three different aspects, which are their qualification, their governing acts and body, and most importantly, their job scope. Anyone who works in the field of mental health will normally have a degree in psychology. This will provide them with a fundamental understanding of the mental health issue. However, if anyone that is interested to pursue a career in counselling, then they would go on to pursue a master degree in counselling in order to become a certified or registered counsellor here in Malaysia. Of course, there is also a group of people who don't have a bachelor degree in psychology, but they only found out their passions in the mental health field later on in their life. So what they will normally do is they will pursue a master degree in counselling psychology in order to become a certified counsellor in Malaysia. In general, Master in Counselling Psychology is very versatile. They generally accept anyone from any background. And what matters the most in counselling psychology is not your qualifications, but rather it is your ability to relate with people from different backgrounds and also culture. So all in all, the minimal academic requirement to become a counsellor here in Malaysia is at least a master degree or above. According to the Ministry of Health, Malaysia right now is short of clinical psychologists, and this does not happen without a valid reason. Clinical psychology in Malaysia is highly competitive and demanding. First of all, in order to become a clinical psychologist here in Malaysia, we need to have at least a master degree in clinical psychology. However, right now there are only a handful of universities, private or local, that are offering the course. So, students need to work super hard in order to earn themselves a spot in the university. On the other hand, it is not unusual for us to find some clinical psychologists to have an usual doctorate degree, or for some with a psychology doctorate degree, which is normally known as Psych D. Whether or not they are having a usual doctorate degree or a Psych D, they are both regarded as doctor by the public. Psychiatrists are a different kind of doctor. They are a medical doctor who have at least spent 5 years of their life in medical school studying medicine, and later on continue to spend another 2 to 3 years specializing in psychiatry. Counseling is quite an established niche of psychology here in Malaysia. They are governed under the Counsellor Act 1988 and also governed by the body known as Lembaga Counsellor Malaysia. So, if any one of you are interested to become a counsellor in Malaysia, these are the act and also governing body that you should look out for. In comparison to counsellor, the role of clinical psychologist is pretty new here in Malaysia. Prior to June 2020, the title of clinical psychologist is not regulated under the law. With that, literally anyone can claim themselves to be a clinical psychologist providing mental health services. However, right now the title is protected under the Elite Health Profession Act 2016. With that, anyone who wants to practice as a clinical psychologist here in Malaysia will need to meet the standard and also register under the law. Well, as mentioned before, psychiatrist is basically a medical doctor who specializes in psychiatry. So, they basically are governed under the Malaysian Medical Associations, and they are regulated under the Mental Health Act 2011. Now, what does a counsellor do? They are responsible in helping the clients to prevent the development of mental illness and also maintain their mental well-being. For example, people who are undergoing some distress such as going through a divorce, loss of job, loss of family members, or difficulty in adapting to a new place, counsellor is helpful in helping them to go through all these challenges. Therefore, the target populations of a counsellor is generally the group of people who do not have serious mental illness like schizophrenia, bipolar, and etc. If a person is experiencing a more serious mental issues like what I just mentioned previously, they would usually visit a clinical psychologist. Clinical psychologists are a group of professionals that is trained to provide clinical assessment and also mental diagnosis. Through the thorough analysis, clinical psychologists will be able to assess a patient's cognitive and also behavioral performance, and they can also assess a person's capability in taking care of themselves. With that, the client can better identify their issues, and the clinical psychologist can choose or implement the right treatment in order to treat their patient. The job scope of a psychiatry and also the job scope as a clinical psychologist can be similar in many ways. For example, diagnosing a patient with mental illnesses or even providing psychotherapy to the patients with mental illnesses. However, one of the distinctions between a psychiatrist and also a clinical psychologist is that only psychiatrists is permitted to prescribe medicine to their patients. On the other hand, clinical psychologists are only allowed to provide psychotherapy. So the next time when you are confused between the role of a psychiatrist and also clinical psychologist, then try asking yourself if they are allowed to prescribe medicine. If yes, then they are psychiatrists. If no, then very likely they are a clinical psychologist. However, this assumption is only applicable here in Malaysia because there are some states overseas that allow psychologists to prescribe medicines to their clients. In a nutshell, counsellor and also clinical psychologists generally have a master degree, while for psychiatrists, they have a medical degree. For counsellor, their target market is generally the normal populations who are dealing with daily stresses, while for clinical psychologists and also psychiatrists, they are dealing with people that are facing serious mental illnesses. Thank you so much for watching this far, and that's all I have for you guys today. If you like this video, don't forget to give this video a thumbs up and also share it out with a friend. If psychology is something that you are interested in, then do not forget to hit the subscribe button and also turn on the notification bell so you wouldn't miss any of my future content. Till then, I will be seeing you guys in my next video. Bye bye!